Intracranial pressure is the pressure exerted on the brain by blood and cerebrospinal fluid. Monitoring it is important because high pressure can lead to brain damage, especially after a head injury. One way to determine intracranial pressure is by looking at the back of the eye, the retina, which is what we're seeing now. Comparing the diameters of the arteries and veins in the retina can tell us if someone's intracranial pressure is normal or elevated. How can we look at the back of the eye? Indirect ophthalmoscopy is a technique to view the retina. We made an indirect ophthalmoscope using a webcam, a condensing lens, lighting, and a frame. The 3D printed frame houses the camera and lens. It allows us to adjust the distance between them, as well as helps make sure that the ophthalmoscope is stable when looking at the patient's eye. In practice, the camera is connected to a computer. The condensing lens is within the 3D printed case, and an external handle allows adjustments. Here is some video we obtained. Unfortunately, we don't get a very clear image of the eye. This could be due to insufficient lighting or the pupils being too constricted. The video that we record is then sent to a LabVIEW program for analysis. To start analyzing the video, we break it down into separate frames. Each frame is labeled by a timestamp and kept in the same folder. Now, we need to pick the best images to analyze. We first filter out frames with lots of artifacts, which we can detect by calculating the pixel values of the image. We then rank the remaining images by their sharpness, and the sharpest image will be our priority for analysis. Finally, users can use a LabVIEW interface, shown here, to measure the diameter of the arteries and veins in the fundus image. They have to use the clamp function to find the blood vessel edges. The computer can then automatically measure the diameters and report an artery to vein ratio, with which we can tell if the ICP is normal, elevated, or low.